Pneumonia is a serious infection that affects the lungs. It inflames the tiny air sacs in your lungs, called alveoli. These air sacs are responsible for absorbing oxygen and releasing carbon dioxide. When they are inflamed and filled with fluid, it becomes difficult to breathe. Imagine a sponge. A healthy sponge has tiny holes that can easily absorb water. Now, imagine pouring glue into those holes. The glue hardens and blocks the holes, making it difficult for the sponge to absorb water. Pneumonia has a similar effect on your lungs. Pneumonia can range from mild to life-threatening. It is particularly dangerous for young children, older adults, and people with weakened immune systems. Understanding the symptoms, causes, and preventive measures can help you stay healthy and protect those around you. Pneumonia can often be mistaken for a bad cold or the flu, but it's crucial to recognize the distinct symptoms. One of the most common symptoms is a persistent cough that produces phlegm, which can be green, yellow, or even bloody. Other telltale signs include fever, chills, and shortness of breath, even when you're not exerting yourself. You might also experience chest pain that worsens when you breathe deeply or cough. Fatigue is another common symptom, leaving you feeling drained and weak. For instance, imagine you've been feeling under the weather for a few days with a persistent cough and fever. You assume it's just a cold, but then you start experiencing shortness of breath, even when you're just sitting down. This is a red flag that it could be something more serious, like pneumonia, and you should seek medical attention promptly. Pneumonia can be caused by various germs, including bacteria, viruses, and fungi. The most common culprit is bacteria called Streptococcus pneumonia. Viruses like the flu virus can also lead to pneumonia, especially in older adults and people with chronic illnesses. Pneumonia is typically spread through the air when an infected person coughs or sneezes, releasing tiny droplets containing the germs. These droplets can then be inhaled by others nearby. It can also be spread through direct contact, such as kissing or sharing utensils with an infected person. Think about it like this. Imagine someone with a cold sneezing into their hand. They then touch a doorknob or a phone. You touch the same surface and then rub your nose or eyes. You've now potentially exposed yourself to the germs, which could lead to pneumonia, especially if your immune system is weakened. Preventing pneumonia is crucial, especially for those at higher risk. One of the most effective ways to protect yourself is by getting vaccinated. The pneumococcal vaccine protects against Streptococcus pneumonia, the most common cause of bacterial pneumonia. Another important preventive measure is practicing good hygiene. This includes washing your hands frequently with soap and water, especially after coughing or sneezing and before eating. If you're sick, cover your mouth and nose when you cough or sneeze to prevent spreading germs. Consider this. You're about to visit your elderly grandparents who are more susceptible to infections. Before you go, you make sure to wash your hands thoroughly and avoid close contact if you have even a slight cough. This simple act of awareness can make a significant difference in protecting their health.